About 15 years ago, I was with the Royal Canadian Mounted Police, and I went through a lot of health issues at that time. And somebody had told me about a naturopathic doctor. So I had no idea what a naturopathic doctor was at that time. And I was in Ottawa at the time. So I went to go see her, and she changed my life. I was on anti-anxiety medications, on sleeping medications, and within 8 months I was off of everything. That's when I knew this was the medicine for me.
I didn't feel like my body was working properly. The medical doctor said I was fine, and blood tests showed that everything was good, so there wasn't anything really bad wrong with me, but there was something not functioning properly. So that's probably the first thing I said to Dr. Kenwall when I came in, that I just don't feel right. I felt like she really cared about me as a person and really wanted to help me through what I needed to go through. But I'm feeling so much better. I'm understanding my body more. I know when I do something that's not good for it, and I'm understanding how to read that and say, okay, that's okay. I'm not beating myself up, because that's one of the big things that Dr. Kenwall is all about too, is, you know, you're human. When I do the right things, or what works for my body, I feel so much better.
When a patient first comes into my office, we go through a complete thorough history, family medical history, their own medical history, their sleep, everything to do with that person. Then we'll also do a physical exam on them as well. So blood pressure, lymph nodes, and it really depends on the complaint to determine how my physical exam would be structured. And then depending on what comes up within that visit would determine what further lab testing, if any, is going to be required, or blood testing. I work a lot with hormones, so whether that be peri or postmenopausal women, fertility years for women, or andropausal men as well. And I work a lot with nutrition. Nutrition is absolutely number one. So I work a lot with the APOE gene diet, and then I also use a lot of botanical therapies as well. I work a lot with athletes. So with athletes, I'll do things such as acupuncture or prolotherapy or neurotherapy. It really depends on what the patient's complaints are.
Last summer, I decided to take on the challenge of going towards a bodybuilding competition. What's interesting is when I first started the training for the competition, I was having a lot of issues. Originally, they started out as migraine headaches, and then it radiated into shoulder pain. And with Dr. Kenwall's help, I've actually had amazing results. Within one treatment of doing neural treatment, she was able to correct my migraine headaches. With the shoulder treatment, she's been doing both neuro and prolo work on me. And if it wasn't for that, I wouldn't be competing in 2 weeks. It's actually kept my shoulders mobile, and it's actually given me a lot more strength in my shoulders. It's been amazing.
Coming to Balance Medical, I feel like I'm doing my life's work. I love what I do and do what I love. Sunday nights is usually people dread, not me. I love knowing that I'm going to work on Monday morning.